Heart disease is one of the world's biggest public health challenges. Affecting millions of people, it is the leading cause of death in many countries. In this video, we will explore the different types of heart disease, their risk factors and how we can prevent them, with a special focus on women's health. Heart disease refers to a range of conditions that affect the heart and blood vessels, and is one of the leading causes of death worldwide. Here's a detailed look. There are several types of heart disease, including coronary artery disease, CAD. This is the most common type and occurs when the arteries that supply blood to the heart become narrowed or blocked due to plaque buildup, atherosclerosis. This can lead to angina, chest pain, myocardial infarction, heart attack, and heart failure. Heart failure. This occurs when the heart cannot pump blood efficiently to meet the body's needs. It can be caused by previous heart attacks, high blood pressure, valve disease, and other factors. Symptoms include shortness of breath, fatigue, and swelling in the lower limbs. Arrhythmias. These are heart rhythm disorders where the heart may beat too fast, too slow, or irregularly. Examples include atrial fibrillation, ventricular tachycardia, and bradycardia. Valve disease. The heart valves may not open or close properly, leading to problems such as stenosis, narrowing, or regurgitation, backflow. This can result in the heart working too hard. Cardiomyopathy. This refers to diseases of the heart muscle that can be caused by genetic factors, viral infections, or alcohol abuse. It can lead to heart failure. Congenital heart disease. These are defects present from birth that affect the structure of the heart, such as defective septa, malformed valves, or abnormal connections between the chambers of the heart. Some risk factors include high blood pressure. High blood pressure damages the arteries over time, contributing to atherosclerosis and increasing the risk of heart attack and heart failure. High cholesterol. High levels of LDL, bad cholesterol, can lead to plaque buildup in the arteries. Smoking. Smoking damages the arteries, reduces the amount of oxygen in the blood and increases blood pressure. Diabetes. People with diabetes have a significantly higher risk of developing heart disease due to the impact of high blood sugar on the arteries. Obesity. Being overweight increases the workload on the heart and is associated with other risk factors, such as high blood pressure and diabetes. Sedentary lifestyle. Lack of physical activity contributes to weight gain, high blood pressure, high cholesterol, and insulin resistance. Family history. If there is a family history of heart disease, the risk of developing it is higher. Stress. Chronic stress can contribute to high blood pressure and other risk behaviors, such as smoking or overeating. Some early signs of heart problems appear, such as chest pain, angina, a feeling of tightness, pressure, or burning in the chest, which may spread to the shoulders, arms, neck, or jaw. Although it is not always a sign of a heart attack, it is an indication that the heart may not be receiving enough oxygen. Shortness of breath. This can occur during physical activity or at rest and can be a sign of heart failure or coronary artery disease. Palpitations, a feeling of rapid, irregular, or jumping heartbeats in the chest, which can be caused by arrhythmias. Unusual fatigue. Feeling extremely tired even with little physical activity can be an early sign of heart failure or other heart conditions. Swelling in the feet, ankles, or abdomen. This can be caused by heart failure, where the heart cannot pump blood effectively, resulting in fluid buildup. Dizziness or fainting. These symptoms can indicate problems with the heart rhythm or insufficient blood flow to the brain. The most common signs and symptoms are chest pain, angina. This can be a feeling of tightness, pressure, or burning in the chest. Shortness of breath may occur during exercise or at rest. Palpitations, feeling of a rapid or irregular heartbeat. Extreme fatigue, feeling unusually tired, even with little activity. Swelling, especially in the ankles, feet, legs, and abdomen, caused by fluid buildup. Diagnosis for heart disease is electrocardiogram. ECG records the electrical activity of the heart and can detect arrhythmias, previous heart attacks and other abnormalities. Echocardiogram. uses ultrasound to create images of the heart, helping to evaluate heart function and detect valvular disease. Stress test evaluates how the heart responds to exercise, useful for detecting coronary artery disease. Coronary angiography, an invasive test that uses contrast and X-rays to visualize the coronary arteries. Cardiac magnetic resonance imaging provides detailed images of the heart, useful for evaluating cardiomyopathies and other conditions. Some treatments for heart disease are medications. Statins, used to lower cholesterol. Antihypertensives, include beta blockers, ACE inhibitors, calcium channel blockers, among others. Antiplatelet drugs, such as aspirin, to reduce the risk of clots. Diuretics, to treat heart failure and control swelling. Surgical interventions. Angioplasty and stenting, a procedure to open blocked coronary arteries and maintain blood flow. Coronary artery bypass grafting, involves creating a new pathway for blood to flow around a blocked artery. Valve surgery, may include repairing or replacing defective valves. Lifestyle changes. Healthy diet, rich in fruits, vegetables, and whole grains and low in saturated and trans fats. Regular exercise, at least 150 minutes of moderate activity per week. Smoking cessation, quitting smoking significantly reduces the risk of heart disease. Stress management, techniques such as meditation, yoga, and behavioral therapy can help manage stress. To promote prevention we must control blood pressure and cholesterol, monitor and maintain within recommended levels. Maintain a healthy weight, through a balanced diet and regular physical activity. Avoid smoking and excessive alcohol, both are important risk factors for heart disease. Regular checkups, especially if there is a family history or risk factors present. Some future perspectives are advances in gene therapy. Research is exploring how to modify genes to prevent or treat heart disease. Implantable devices, such as more advanced pacemakers and ventricular assist devices, VADs, are becoming more sophisticated. Personalized medicine, therapies tailored to the genetic profile and specific biomarkers of patients. Understanding heart disease, its risk factors, signs and available treatments is fundamental to prevention and effective management. Awareness and a healthy lifestyle can significantly help reduce the risk of these conditions. Lifestyle changes are important for preventing heart problems. 1. Healthy diet. Reduce your intake of saturated and trans fats. Foods high in saturated fats, such as red meat and full-fat dairy products, can raise LDL cholesterol. Increase your intake of fruits, vegetables, and whole grains. These foods are rich in nutrients and fiber that help control cholesterol and blood pressure. Reduce your salt intake. High salt intake is associated with high blood pressure. Limiting your intake can help keep your blood pressure at healthy levels. 2. Regular exercise. Moderate physical activity. Getting at least 150 minutes of moderate physical activity per week, such as walking, swimming, or cycling, can help improve heart health. Strengthening your muscles. Resistance exercises, such as weightlifting, are also important for cardiovascular health. 3. Weight control. Maintaining a healthy weight, reducing body weight, even by just 5 to 10%, can significantly lower your risk of heart disease. 4. Smoking cessation. Quitting smoking. Quitting smoking can reduce your risk of heart disease almost immediately, and the benefits increase over time. 5. Moderate alcohol consumption. Limiting alcohol. Excessive alcohol consumption can lead to increased blood pressure and triglycerides. Drinking in moderation, up to 1 drink per day for women and up to 2 for men, may have a protective effect on your heart. 6. Stress management. Relaxation techniques. Practicing meditation, yoga, or other relaxation techniques can help reduce stress and improve cardiovascular health. Getting enough sleep. Quality sleep is essential for overall health, including your heart. 7. Health monitoring. Regular checkups. Regularly measuring your blood pressure, cholesterol levels, and blood glucose can help you detect problems early and take preventive measures. Medical checkups. Regular visits to your doctor to assess your risk factors and get routine checkups are essential for preventing heart disease. Making these lifestyle changes can not only reduce your risk of developing heart disease, but also improve your overall quality of life. Adopting healthy habits early on is the best strategy for protecting your heart and ensuring a longer, healthier life. Raising awareness about the impact of heart disease, especially in women, is crucial, as these diseases have traditionally been underestimated and often misdiagnosed in women. Here are some ways to address this issue. Recognize underestimated risk in women. Historically, heart disease has been seen as a predominantly male problem, which has led to underestimation of the risk in women. However, heart disease is the leading cause of death among women in many parts of the world, surpassing even breast cancer. Understanding the differences in signs and symptoms. Symptoms of heart disease can manifest differently in women compared to men. While men often experience classic chest pain as the main symptom of a heart attack, women may experience more subtle symptoms, such as pain or discomfort in the neck, shoulders, back or jaw, shortness of breath, extreme, unexplained fatigue, nausea or vomiting, dizziness or feeling faint. This variation in symptoms can lead to delayed or misdiagnosis, which increases the risk of serious complications. Specific risk factors for women. In addition to traditional risk factors such as high blood pressure, high cholesterol, diabetes and smoking, women face additional risk factors, including pregnancy-related conditions, complications such as preeclampsia, gestational diabetes, and high blood pressure during pregnancy increase the risk of heart disease later in life. Menopause. After menopause, estrogen levels drop, which can accelerate atherosclerosis and increase the risk of heart disease. Polycystic ovary syndrome, COS. This condition, which affects hormone levels and is associated with insulin resistance, also increases cardiovascular risk. Public education and awareness. Public health campaigns. Health organizations can create targeted campaigns to educate women about the risks of heart disease, the signs to look for, and the importance of regular screenings. Initiatives such as Go Red for Women, led by the American Heart Association, are examples of effective efforts to raise awareness. Community outreach, hosting workshops, lectures, and health events in communities can help educate women of different ages and socioeconomic backgrounds about heart disease prevention. Medical education. It is essential that health professionals are aware of gender differences in the manifestations and risks of heart disease, ensuring that women receive the correct diagnosis and treatment. Encourage adoption of healthy lifestyles. Encouraging women to adopt healthy habits is essential for preventing heart disease. Balanced diet. Promote consumption of a diet rich in fruits, vegetables, and whole grains and low in saturated and trans fats. Regular exercise. Encourage at least 150 minutes of moderate physical activity per week. Weight management. Maintaining a healthy weight can help reduce the risk of heart disease. Smoking cessation. Quitting smoking is one of the most effective measures to reduce cardiovascular risk. Support and encourage research. Gender-specific research. Invest in research that specifically addresses how heart disease affects women, including differences in risk factors, symptoms, and responses to treatment. Encourage women to participate in clinical trials. Historically, women have been underrepresented in clinical trials for heart disease. Encouraging their participation can lead to more accurate findings and more effective treatments for them. Building support networks. Support groups. Create or promote support groups where women can share their experiences, learn from each other, and support each other in preventing and treating heart disease. Leadership initiatives. Encourage women leaders in the community and health professions to become advocates for raising awareness about heart disease. Advocacy and health policy. Public health policy. Advocate for policies that promote women's heart health, including access to health care, prevention programs, and treatment support. Government initiatives support government efforts to prioritize women's cardiovascular health, including funding for research and educational campaigns. Caring for your heart is caring for your life. Raising awareness about heart disease, especially among women, is the first step toward prevention. With small changes in your daily life and paying closer attention to your body's signals, you can avoid many complications. Remember, your health is your most precious asset. Stay informed, make healthy choices, and don't hesitate to seek medical help when needed. Together, we can overcome this challenge and live longer, healthier lives. Thanks for watching, and don't forget to like this video, follow us, and share this video so more people can protect their hearts too. See you next time.